Hello students and welcome to today's class. This is Gilbert and I'll be taking you through Introduction to Telemedicine. So today our lecture is structured to have 8 modules, which one will be looking at Kenyan health landscape and the application of or looking at the telemedicine within the Kenyan health landscape. We'll look at what is telemedicine, defining it, and then we'll look at the benefits of telemedicine. We'll go forward to look at the different types of telemedicine technology, services, and tools that are used. We'll also have some time looking at how we can apply and how it has been applied in different setups in this 21st century. Then we'll look at the development of telemedicine in terms of stages and the different phases. We also look at the barriers to telemedicine and how they can be overcome. And finally, we'll look at opportunities for application in low, medium income countries. So we start off by looking at the Kenyan health sector landscape. And basically in Kenya, what we know is that healthcare is skewed towards the urban settings. And this is despite the fact that 70% of Kenyans live in the rural areas. And that means that quite a large number of populations may not be able to access healthcare since the investment is in the urban settings. We still have very limited investment in the rural setup because there are very few facilities, and that has implication in terms of the number of specialists available in these areas. For instance, according to the current statistics, the healthcare workers concentration is only 1.5 health workers per 1,000 population. And the WHO recommends 2.4, which basically means there is a very big gap in terms of the healthcare shortage for our country. And this is also reflected by the fact that specialists, 80% of them, they are concentrated in the urban settings. That means the many people who are in the rural setup cannot access the basic as well as the specialist services because they are basically allowed and concentrated in the urban settings. And with the poverty levels, which is as high as 36%, what does that mean? That many people may find it very costly to get specialist services when you look at even in terms of the travel cost and the rate and things. So in terms of this, what we mean is that despite legislating healthcare access to every population or every person irrespective of the ability to pay, then we have a barrier and we have a challenge because most of the remotes and the most of very rural areas may not have access to these services. And so therefore, we ask ourselves, how do we achieve the commitment of the Constitution of Kenya and the commitment of the government in terms of the universal healthcare access? That as a solution through telemedicine. And that's why today we want to look at what is telemedicine and how does this come in to bridge this gap. Number one, we understand telemedicine is provision of clinical care services over a distance. Remember in our previous slide, we talked about rural areas not able to access services because of distance and lack of enough staff to provide these services in the rural setup. And therefore, how can we overcome this distance? Is by leveraging on information technology, is by adopting electronic communication as a media to be able to reach these people in the most remote areas. And if you look at the picture here, you see that it becomes very easy for us to be able to bridge the gap by connecting specialists through specialist networks and bringing the different ICT applications in healthcare together to connect patients and physicians to provide the same care with moving them. And through these advances in technology, we can provide a range of services ranging from primary care, diagnosis, triaging, treatment, as well as referral for both the diseases and injuries. Medical specialists can be able to practice over these networks or this information technology. And more importantly, I want to emphasize the opportunities around emergency medical services, because today we do not have paramedics in the heart of the facility setup. And so therefore, what are the opportunities in terms of technology? Is to leverage in them to reach these people who may not have access to these life-saving interventions. And so therefore, with technology, what are some of the benefits that a country, patients, or even providers may be able to get from application or use of telemedicine? There are a number of benefits, ranging from efficiency, like efficiency resource utilization, because people are not moving. They are provided or they are getting these services from wherever they are. What we mean is you are cutting the cost of travel, you are cutting the cost of the specialist, which may be very high, and therefore get the same quality or high level quality of services. So we have a number of them, ranging also from early intervention, like you are able to understand or identify a problem, be able to prioritize it, and refer it to the next facility for proper intervention. And that way, we can be able to address burden of disease at a very small cost. And this is what many countries can be able to leverage on. So looking at this, both the patient, the healthcare provider, and the facilities, they have a lot of benefit that comes to them in terms of leveraging on telemedicine or adoption of telemedicine. But you see here in our low and medium income countries like Kenya, like countries in Africa, telemedicine is yet to be optimized. We see a number of services are yet to mature. And that means perhaps we may be missing out on some of the benefits that accrue from telemedicine. And so therefore we say telemedicine is adoption of this technology that provides high access or improved boosted access to both primary and specialist care or clinical services to the most underserved at the most optimized costs possible. And this is a very good opportunity to achieve the universal healthcare agenda. That is, improving on access, improving on equity, efficiency, and cost effectiveness of the interventions. And therefore, this becomes a very positive or a very good case in terms of advocacy and adoption of telemedicine, both to developed and developing countries. But to now, even as we look at the benefits, let us ask ourselves, what are the telemedicine technologies, services, as well as the tools that are available for different stakeholders to adopt and leverage on them? In terms of technology, we have two main technologies that can be adopted for telemedicine. One is where we talk about interactive real-time interaction technology that allows for interaction between the patient and the provider, or a provider and providers. And that involves use of like videos or face-to-face virtual and e-virtual consultations and discussions with patients over a distance, over miles and miles. So people can come together like on a video, like an audio. You can pick up your phone and have a conversation, and therefore get specialists as well as take a consultant advice in terms of the issues or the health problems, and therefore make relevant decisions in terms of your care seeking pathways. We also have store and forward, and this is applying for most non-emergency cases like the radiology. We get, for example, your picture, like the CT scan, the images, store them and then send to a facility with a specialist to be able to provide the interpretation and the guidance in terms of the problems that you are facing and how that can be resolved or how you can be assisted. And this is a very good case in terms of how we can be able to provide the care in most effective and efficient manner. So in terms of type, therefore, we have four types. We have remote monitoring. We can monitor our patient whether they are at home by having applications of or technological applications like devices like, for example, blood sugar test, ECG machines, and that data can be relayed to the facility so that you can be provided and supported well at home. Patient can receive this care well at home without necessarily moving to the facility. And that has a strong or a very good positive outcome in terms of those patients who require frequent follow-up or who require monitored care while at home to reduce the healthcare cost, which is a serious cost in terms of what it drives people to poverty. And so again, we look at arm health today mobile technology has expanded. People have mobile phones. Me, I have a mobile phone, smartphone, and most of the students here have mobile phones. So we can leverage on mobile phones to initiate clinical care services between patient and providers. You can pick a video call with your phone. You can have messages. Like today, I received a message for COVID-19 in terms of how I should be able to protect myself and such other messages. And this is part of telemedicine. Then we have store and forward that I've talked about, and real-time interactive. And there are a number of tools in terms of this technology. We have emails, as I've talked about. We have videos. We have things like phone, and we have internet. Every day, students, I find them, for example, going to the internet, seeking information, as well as calling their loved ones, or even when you have an issue, raising a phone, talking to your either sister or a friend or a healthcare provider to seek more advice. This is telemedicine in practice. So basically, almost all of us perhaps have been able to interact with telemedicine, only that the scale of adoption and application may not be as high or as expanded as we would have liked it to be. And so this means that at the heart of telemedicine is technology. And so today we're talking about technology in healthcare. And we'll be looking at opportunities or examples of where this has been leveraged. And so therefore, I want to have a short discussion on a real case scenario where telemedicine has been practiced even as we face the most global public health threat and pandemic, that is coronavirus, COVID-19. Today, we know very well that COVID-19 threat or disease outbreak was reported in 2019 in China. And so after this outbreak, there was problems that came with it. For example, because of high number of masses of people who were affected, people could not be able to always move around because of restriction to movement. And again, the facilities were being crowded. There were risk of infection. And again, the number of specialists were overwhelmed. So there were so many challenges in terms of face-to-face healthcare provision. And therefore, China leveraged on the investment in telemedicine and launched online clinic, what we call e-virtual telemedicine clinic, where patients could be triaged, diagnosed, and treated while back at home. And so that provided an opportunity to not only have early identification of a case, but also with very little cost, diagnose and refer very serious cases to the facilities for treatment. And this has worked. For example, we have Alibaba Group. Everyone knows it. They have at e-online clinic or virtual visit where patients are diagnosed online. And that increased the access to these services to patients even in the most remote areas. And so even one of the most actually positive outcome of this was that there was a reduction in terms of what we call infection, because remember, a number of healthcare providers have died as a result of interacting with the patient during the medical care provision or the medical care process. And so therefore, we have seen this work in China. US, Washington, made a declaration that patients should be provided this service while at home. Even the results should be sent at home. And that provides a good example of how telemedicine can be leveraged on. And today, countries like Kenya are adopting. Look at it, for example, in Kenyan National Hospital. Yesterday, we launched one of the most unique telemedicine systems for Kenya. And now, our specialists can discuss issues with doctors from China, doctors from America and French and other countries, and leverage on their specialist care and their technologies to provide the same quality of care instead of people moving around and attracting a lot of cost while getting the same quality of services. And so I just for a second and say, for example, there is a new technology or innovation that has come by Alibaba where through online intelligence system, you can get result of whether you have coronavirus or not within 20 seconds, 20 times more of promptly than a healthcare provider can do through face-to-face interaction. And this is a very good example of innovation, technology, and healthcare. What are some of the features for this? One is like in China, they partnered with telecommunications because some of the remote areas don't have network. And of course, they need to work like, for example, Safaricom and Airtel to provide the network because this requires very strong network and bandwidth to be able to have quality video and communication. Number two is the integration of systems. What we have, the problem with the developing countries is that systems don't talk to each other. They are parallel. You know, they are standalone. All this information needs to be brought together for providers to be able to make what we call optimal decision and care delivery pathways and continuity of care. And so therefore there is an opportunity of integrating and as well as ensuring there is interoperability of systems. Number three is technological investment. I know in Africa and other countries we have a problem and we are lagging behind on this, but when we invest in websites, mobile phone secure systems, and this technology and equipment, this is what China was able to leverage on, US and those other countries. But above all, staffing skills, technology competence, they should be able to use and appropriate legislative framework. But then look at a scenario for African countries to leverage on it again. What we call maternal child health care. Every country is so much committed to providing because it is a proxy indicator of development and the health successes for a country or health progress in terms of the indicators. And it is well captured under UHC or Universal Healthcare Agenda or coverage agenda for our country. So with this, when there's a pregnant woman needs, for example, to visit the facility to get ANC services, to get some counseling. When they go, for example, is what we normally know about postpartum depression, stress or disorder and those things. And a lot of people are suffering. But the question is, should they always go to the facility? Should I go to get ANC counseling at the facility and have all that cost? There is an opportunity of leveraging telemedicine during and even after pregnancy. And this is what we are talking about. We are saying that telemedicine can provide online communication with these pregnant women. It can provide mental health care, for example, for those who have stress. And they can also have what we call virtual ANC visit. I want to say this, students, that WHO has recommended the increase of ANC from 4 to 8. Now, the question is, if today get a given 4 ANC is a difficult problem or is not possible, what about 8? So what is the opportunity? Perhaps telemedicine. Who knows? And so therefore, there are many areas we can talk about. But let's talk about development of telemedicine stages and see where we are as a country and perhaps what is your role as a provider, as a professional, or someone else who is interested in terms of our people in line with our constitution provisions and UHC agenda for strategic development goal for the world by the UN. There are 8 stages from advocacy. When you advocacy, the stakeholders are aware of the same and they support it, to policy, to then infrastructure, which includes equipment and facilities, capacity building, funding, research, but above all, piloting and what we call scale up. Now, one of the things that you need to note is that Africa and countries like Kenya, we are still at stage 1. Actually, this thing about KNH is a surprise. And it came because of our response to an emergency crisis or the issue. And therefore, we need to talk a lot about this telemedicine and increase its adoption by these African countries because we need to move to policy. At least India is in a policy stage, but we have yet a long way to go. But with this benefit and what coronavirus has taught us today, I cannot be surprised to see many countries rush and invest in telemedicine and change the way we provide our healthcare, re-engineering, restructuring the way we provide care in terms of the systems, the processes, and all those other things. Barriers to telemedicine. What are the barriers? There are many. And of course, we have to weigh both the barriers and the benefits. One of the things that you realize is that these barriers is one of the reasons why many countries may be, for example, not to be able to adopt the same. For example, issue of practice. What if I'm practicing? And then there is a medical legal liability. Which court do I go? Can I practice in Uganda? Can I be brought, for example, here in Kenya? So what is the line of practice? What is the line of jurisdiction? So there are issues to do with the policy, to do with the training, and to do with the internet. You know very well some areas are very poor network connection. And so therefore all these things, system, standalone system, and all these challenges needs to be addressed. And importantly, the role of the community and the patient in terms of the telemedicine. But importantly is that telemedicine practice and market is least developed. How can I demonstrate that? Look at this. This figure talks about 46.9% market of telemedicine in America. The same, almost the same size in Europe. But look at Africa and Middle East, we are sharing a very small proportion. That means the market is poorly developed. Look at this. In 2018, the telemedicine market was worth 8.3 billion shillings. In 2025, what are we projecting? More than even double. 130.5 billion US dollars, not shillings. And so, with this, Africa has a very low market or a very small market. But we'll see that the practice has actually expanded from teleconsultation, teleeducation, telehome market to neurology. Like today, most of the people who get emergency services, they are referred to Kenyatta because they are no specialists and neurologists. And those people can be treated right here in Thika, instead even of getting them to. We can even have what you call robotic surgery. But then we have to invest in this telemedicine and increase our market. And therefore, we need this in terms of appropriate registration and policies and reimbursement for insurance and these other things, integration of systems. And this can be very useful in terms of emergency medical services, in terms of referral system, and in terms of how we provide care, at least with the very low cost. But before we finish to go to the conclusion slide, I want to talk about this M-Health. And I talked about it. Everyone today, every student has a smartphone. And many people are having these phones. So the opportunities are rich. And everyone should be now talking about how do we leverage in terms of the investment that is there, and then link them to now those other high-level technologies and sophisticated technologies to provide the same. So what is the take-home message now? Being our last slide is that what we are seeing in the threads and what even coronavirus has taught us is that, in fact, moving forward, just the same way we are saying here in Mount Kenya University, that the university of the future will be online, is that even healthcare may be online. And the future of this universal healthcare agenda, perhaps we need a rediscussion about the same. Maybe online, telemedicine. That has a serious implication in terms of efficiency, effectiveness, access, and utilization. And that may be also the great answer everyone is looking at in terms of addressing these emerging diseases, like even uncommunicable diseases like diabetes, and cancer. Like today, how many people come to the facility at stage 4 before they are diagnosed? And then it is. So they come, for example, for treatment in the facility when the cancer is at stage 4. And so therefore, in this technology provides one of the best case investment scenario for countries like Kenya and others that are struggling with their healthcare budget. And the ones of Neil Armstrong is that one single coin in telemedicine, in technology, may have ripple effect in terms of the benefit that we receive. And so therefore today, we stop there by saying that perhaps this discussion needs to continue, and thank you very much for listening.
We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.